The rehabilitation is a set of restorative healthcare interventions aimed at helping people to function better. And being able to function well enables us to contribute towards our family, our societal, and other roles that we play in our communities. Many people will need rehabilitation, and often it's required after an injury, after surgery, or maybe to deal with the sequelae of conditions or illnesses. Rehabilitation helps you to function better, but by doing that, it also restores independence and instills a sense of dignity in individuals. Many South Africans suffer from functioning problems, and we have found that at least 1 in 3 people visiting a primary healthcare facility or local clinic suffer from some form of functioning problems. The most common functioning problem affecting South Africans involves movement-related problems such as difficulty walking, or sitting, moving from sitting to standing, and other mobility issues. But speech problems, hearing problems, as well as other mental health problems such as anxiety has also got a very high occurrence. Unfortunately, many of the patients who require rehabilitation do not receive the services that they need. We have conducted a national study, and we have seen that the need for rehabilitation among South Africans by far outweigh the capacity, particularly in the public sector of the workforce, to serve those needs. It's important to remember that rehabilitation is important for people with functioning problems, but also for people with disability. And disability refers to functioning problems that have a significant impact on your daily activities and also interferes with your ability to interact with your environment. And often this form of functioning problem is long-term or it's permanent. Some people with disabilities and those with just functioning problems both require rehabilitation, and the duration of the rehabilitation or the intensity depend on the needs. For example, children who are born with congenital diseases, they will need rehabilitation from childbirth for the rest of their lives. But others who suffered from injuries or maybe just recovering from surgery will need rehabilitation at a particular point in time while they're recovering from temporary functional incapacity. Individuals with disabilities will, in most instances, need rehabilitation for the rest of their lives, and obviously this can be from birth or after they have sustained a life-changing injury or ramifications of a disease. In South Africa, we have also found that most of the therapists work at large hospitals or specialist hospitals, and very few work at primary care, which are the local clinics within the communities. This implies that somebody who, for example, had a stroke and is referred from a large specialist hospital to a local community center to further their rehabilitation may not have timely or may not have any access to rehabilitation services. So it's therefore important for you to inquire which rehabilitation services are closest to where you live, because there are many advantages to accessing rehabilitation services within your community close to home. From a therapeutic point of view, the advantages include that the therapist can tailor the interventions to shape your local and personal home context, But from a patient perspective, there are also advantages because there's often not a need for a carer to take leave from work and to accompany somebody to attend rehabilitation. Also, transport cost is significantly reduced because they can often walk to the clinic, and thereby they can attend these sessions more frequently, and they can also, of course, thereby improve the outcomes of the rehabilitation process. So rehabilitation is important because it does, whilst it improves your functioning in your daily activities, it actually also contributes to your overall health and your overall physical and mental well-being. And therefore, it's important for you to seek rehabilitation services if you think that you can benefit. And this is important if you are, for example, referred from a specialist hospital, because we know that the services are limited in the communities. But it's also important for you to report a functioning problem to the healthcare professional at your local clinic and actively seek rehabilitation or referral to rehabilitation services, because it will ultimately contribute to your overall health. Rehabilitation will also help you cope better by helping you with self-help strategies and education for your family, and thereby it prevents complications and further potentially costly healthcare interventions. So in summary, it's important to remember that functioning problems are very common among South Africans, but many don't access the rehabilitation services, even if it is available. And it's important for you to advocate for services in your community and to actively seek rehabilitation if you suffer from a functioning problem or some form of disability.